Okay, hello, good morning. Coming to the today's weekend wisdom short, differences between true versus false labor pains. So most of us have a difficulty to identify which one is the true labor pain and which one are the false labor pains. So let us have a quick glance about the differences in the true and false labor pains. So the true labor pains, they are painful uterine contractions at regular intervals. Usually in the second trimester and the third trimester, you will be having a dull in nature of the contractions of the uterus. But these are not regular. They occur at an intermittent times. So such contractions we call as a Braxton Hicks contractions that are false labor pains. But in true labor pains, you have a painful uterine contractions at regular intervals, like 2 contractions for 10 minutes, 3 to 4 contractions for 10 minutes, and whenever the labor is progressing, you will have the highest intensity. Okay, the frequency of the contractions increases gradually, and the intensity and duration of the contractions also increases progressively in the true labor pains. But coming to the false labor pains, they are dull in nature and they are confined to the lower abdomen and groin. Okay, though she complains of more of a pain in the lower abdomen and not at the upper abdomen. But in the true labor pains, you will be having pain all over the uterus and more at the fundus area. Whenever you examine the patient in the true labor pains, there will be hardening of the uterus. So whenever you start with examining, she will be having the hardening of the uterus in the true labor pains. But when compared in the false labor pains, this is not associated with the hardening of the uterus. Even if the uterus is getting hard, it only gets hard for about 5 to 10 seconds. Less than 15 seconds, you will be having a contraction. And in the true labor pains, if we go for a pervaginal examination, you can have a presence of show. But in the false labor pains, you do not have any association with the show. And there will be a progressive effacement and dilatation of the cervix. So you will be having the cervical changes in the true labor pains. And there will be descent of the presenting part. But in the false labor pains, you cannot identify the descent of the presenting part like at +1, 0, -1. So there will be no descent of the presenting part. And the formation of the bag of four waters also can be seen in the true labor pains. The main important differential point is in the true labor pains, it is not relieved by enema or sedatives. So whenever an 8th month or 9th month patient, like whenever 32 to 36 weeks pregnant patient is coming with the labor pains or coming with a pain abdomen, then we offer her enema. So if these are the false labor pains, usually they are relieved by enema or any analgesic or sedative. But if there are true labor pains, you cannot stop the labor pains. So these are not relieved by enema or sedatives. Okay, so these are the most important differences. This is usually important in your clinical practice so that we can prevent more of a preterm deliveries also. Because of this, you cannot identify the false labor pain, so you might induce it and you might land up in a preterm delivery also. That's why we should have a very clear idea about true labor pains and false labor pains. Let me have a quick glance about this true and false labor pains. So the true labor pains, you will be having frequently increasing uterine contractions, increasing in the pain and intensity. But in the false labor pains, you will be not having any increase. Only this is limited to lower abdomen or groin area. Okay, and these are very dull in nature. There will be hardening of the uterus in the true labor pains and no hardening of uterus in the false labor pains. Then there will be no descent of the presenting part in the false labor pains, and presence of show in the true labor pains, absence of show in the false labor pains. And true labor pains cannot be relieved by enema or sedatives, and the false labor pains can be usually relieved by enema or sedatives. Hope this helps you. Happy learning. So if you have any topic that you want to be discussed as a quick 2-minute weekend wisdom short, please let me know in the comment section. Thank you.